In 2020, there were changes to some of the laws in Florida related to services for Floridians with developmental disabilities who receive services from APD. These new requirements are effective July 1, 2021. Some of the changes in the law resulted in updates to the APD iBudget rule. This training is intended to assist waiver support coordinators in the approval process for iBudget waiver services. To understand all changes to the iBudget rule, please review the iBudget rule on the APD website. By the end of this training, you should understand changes in the iBudget rule that impact the service approval process, gain knowledge of the verification of available services form and its role in requesting waiver services, understand changes to the significant additional needs definitions and process, and understand the documentation requirements for cost plans and significant additional needs. Services must not be authorized under the iBudget Florida waiver if they are available from another source. It's the WSC's responsibility to first ensure that the same type of service offered through the waiver cannot be accessed through other funding sources such as natural and community supports, third-party payers, Medicare, and other Medicaid programs. The verification of available services form is a new form required in the iBudget rule. Waiver support coordinators will complete this form so that the agency can certify and document that the client has utilized all available services through the Medicaid state plan, school-based services, private insurance, other benefits, and any other resources such as local, state, federal government, and non-government programs or services and natural or community supports that might be available prior to requesting waiver funds. The verification of available services form documents and verifies that the iBudget Florida waiver is the payer of last resort. A valid and accurate verification of available services form is a condition prior to the authorization of services. The WSC must complete and submit the verification of available services form to the agency, 1, at the time of any request to add or increase services, or 2, upon request from the agency when it is making determinations of medical necessity for waiver services. When support coordinators request services on behalf of clients for any reason, the rule requires that the support coordinator complete a verification of available services form with supporting documentation. This form will enable APD to certify and document that all available resources were explored prior to using iBudget waiver services. This form will increase consistency on how the use of outside resources is monitored and make the process transparent to our stakeholders. When a WSC submits a request for increased services through the significant additional needs process, the verification of available services form must document attempts within the last 30 days to locate natural or community supports, third-party payers, or other sources of support to meet the client's health and safety needs. Now that you know when the verification of available services form is required, we will walk through each section of the form. The top of the form includes basic demographic information. The WSC will include the client's name and APD iConnect ID. The WSC name should also be identified. The WSC will be able to include a complete form in APD iConnect. Section A should be completed to identify natural supports available to the client. The iBudget rule defines natural supports as unpaid supports that are or may be provided voluntarily to the client in lieu of waiver services and supports. Any determination of the availability of natural supports includes, but is not limited to, consideration of the client's caregiver's age, physical and mental health, travel and work or school schedule, responsibility for other dependents, sleep, and ancillary tasks necessary to the health and well-being of the client. If the client has no natural supports, the WSC can skip Section A of the form. This section includes a statement of the parent, legal representative, or other caregiver's health limitations. Under Item 1, the WSC will describe any health issue, disability, or other concern that the parent, legal representative, or other caregiver has that limits his or her ability to provide services or supports to the client requested through the iBudget waiver. This may also include responsibilities for providing care to other dependents. An example might include, but is not limited to, Jane's mother is a single parent. She currently provides Jane's personal care. However, she's having a knee replacement surgery in a couple of months and will not be able to provide care for 6 weeks during her recovery from surgery. The description should be based on factual information, and there should be supporting documentation to substantiate the information included here. Any physical, medical, or mental limitation to care for the client must be corroborated by an appropriate healthcare practitioner. The WSC is required to attach the supporting documentation used to make these statements by attaching it in APD iConnect. Next to Item 2, the WSC will document that the information was attached in APD iConnect. In Jane's example, the WSC will attach a statement from Jane's mother's physician that documents the upcoming surgery and recovery period. In Section A, Items 3 and 4 address the parent, legal representative, or other caregiver's work or school schedule. In Number 3, if the work or school schedule of the parent, caregiver, or legal representative impacts the ability to provide needed support to the client, the WSC will describe that here. For Item 4, the WSC will be required to attach the documentation that they relied upon to make the statement in Item 3 in APD iConnect. This might include information from an employer or school. In Section B of the form, the WSC will document services available to the client through other government programs. Under Item 1, if the client is enrolled in a managed care plan through Medicaid, the WSC will provide the name of the plan and describe services received. If the client is not enrolled in a managed care plan, the WSC can skip this item. The WSC will only need to complete Item 2 if the client is requesting adult dental services through the iBudget waiver. Otherwise, this item can be skipped. In the event that adult dental services are requested, the WSC will explain why the specific dental treatments are not being requested through the dental managed care plan. Also, if the services were denied by the dental managed care plan, the WSC should attach documentation of the denial in APD iConnect and specify this information on the form. The WSC will complete Item 3 for all clients under age 21. However, if the client is age 21 or over, skip Number 3. When completing this section, the WSC will describe the home health services that the client receives through Medicaid. Also, if the client is not accessing home health services such as personal care, nursing, or therapies through Medicaid, the WSC will document the status of accessing those services on the form. For example, for a client under the age of 21, the WSC may include a statement such as, Jane Doe receives 8 hours per day of nursing through Medicaid 7 days per week. Or for a client under 21 who is not yet receiving home health or therapy services, include a statement such as, authorization for personal care service is pending review with Medicaid. The WSC will only complete Item 4 in Section B for clients who are age 20 and over. Otherwise, the WSC can skip this section. For clients 20 and over, the WSC will document the therapy services that the client receives from Medicaid. Item 5 in Section B relates to clients under the age of 21 who are requesting services due to maladaptive behaviors. If the client is age 21 and over or does not have maladaptive behaviors, the WSC can skip this section. WSCs will complete Section B, Item 6, when consumable medical supplies or durable medical equipment is requested through the iBudget waiver only. In this section, the WSC will be documenting access to these services through Medicaid. For example, item requested through the waiver is not available for clients over 21 through Medicaid. WSCs must complete Section B, Item 7 for clients who are dually eligible for both Medicaid and Medicare. In this section, the WSC will document services accessed through Medicare, not including prescription drugs. If the client does not have Medicare, the WSC can skip this item. In Section B, Item 8, document educational and vocational services accessed by the client and the schedule of services. Example might include John Smith goes to school from 8:30 to 3:30 on weekdays, or Jane Brown started Phase 1 with VR in March. Complete Item 9 when a client has a mental health diagnosis. Otherwise, this section can be skipped. If the client has a mental health diagnosis but no services have been received, the WSC must indicate what has been done to assist the client in accessing mental health treatment. An example might include the local mental health clinic is closed and there are no other facilities capable of treating individuals with intellectual disabilities within driving distance. Under Item 10, document any government resources accessed by the client. This may include any county, state, or federal programs. For example, Ms. Jones attends a volunteer program at the county animal shelter where she's learning how to care for animals. Section C identifies community supports and resources. This must be completed for all clients. The WSC should document all community supports the client is receiving and describe what the WSC has done to secure resources over the last year with specificity. An example might include John Doe plays board games at the community center once a week. Transportation is provided by his friend that he met at the community center. The WSC contacted ABC Therapeutic Rec on June 2, 2021, and XYZ Respite Centers on June 3, 2021 for recreation opportunities on weekends, but both programs reported that there was no availability. The WSC will complete Section D for any clients with private health insurance. This will include identifying the insurance carrier, services the individual receives from private insurance, and supporting documentation that the WSC relied upon to provide the information. For clients without private insurance, the WSC can skip this section. The bottom of the form includes a place for the WSC signature and date. By signing the form, the WSC is acknowledging 1, that the form was completed accurately to the best of their knowledge, 2, that the WSC performed all reasonable inquiry into the responses, 3, that the WSC is familiar with the responsibilities to ensure that services offered through the waiver cannot be accessed through other funding sources, and 4, if the WSC violates the terms of the verification, the agency may terminate the Medicaid Waiver Services Agreement. The way that the agency calculates the iBudget amount remains the same. The iBudget amount is still the algorithm amount plus any significant additional needs. When APD runs the algorithm for a client, the WSC is still required to complete the Amount Implementation Meeting, AIM, and submit the AIM worksheet in APD iConnect per usual processes. There is a new definition for significant additional needs. Significant additional needs means, as provided in Section 393.06339 of the Florida statutes, an additional need for medically necessary services which would place the health and safety of the client's caregiver, or the public in serious jeopardy if not met. The term also includes a need for services to meet an additional need that the client requires in order to remain in the least restrictive setting, including but not limited to employment services and transportation. The agency may provide additional funding only after the determination of a client's initial allocation amount and after the WSC has documented the availability of non-waiver resources on the verification of available services form. Examples of SANs include a documented history of significant, potentially life-threatening behaviors such as recent attempts at suicide, arson, non-consensual sexual behavior, self-injurious behavior requiring medical attention, dementia, or age-related behaviors that present significant health and safety risks. A complex medical condition that requires active intervention by a licensed nurse on an ongoing basis that cannot be taught or delegated to a non-licensed person. A need for total physical assistance with activities of daily living such as eating, bathing, toileting, grooming, dressing, personal hygiene, lifting, transferring, or ambulation. Permanent or long-term loss or incapacity of a caregiver. Loss of services authorized under the state Medicaid plan or other school system due to change in age, significant decline in medical, behavioral, or functional status, lack of a meaningful day activity needed to foster mental health, prevent regression, or engage in meaningful community life and activities, one or more of the situations described in Rule 65G-4.0213 Florida Administrative Code Crisis Status Criteria, which are homeless, danger to self or others, or caregiver unable to provide care, and risk of abuse, neglect, exploitation, or abandonment that can be mitigated with waiver services. There is also a new term in the iBudget rule for a significant change in condition or circumstance. A significant change in condition or circumstance is a significant change or deterioration in a client's health status, an actual or anticipated change in the client's living situation, a change in the caregiver relationship or the caregiver's ability to provide supports, loss of or deterioration of his or her home environment, or loss of the client's spouse or caregiver. A significant change in condition or circumstance may also sometimes be the basis for requesting SANS funding. Examples of a significant change include a deterioration in the health status that requires that the client receive services at a greater intensity or in a different setting to ensure the client's health or safety, the onset of a health, environmental, behavior, or medical condition that requires the client receive services at a greater intensity or in a different setting to ensure the client's health and safety, or a change in age or living setting resulting in a loss of services funded or otherwise provided from sources other than the waiver. This may include a change in living setting which requires a different service array or a change in the availability of health status of a primary caregiver that prevents that caregiver from continuing to provide support. When a client has a significant additional need or a significant change in condition or circumstance, if the need cannot be met through any other resource, the WSC should submit a significant additional needs request in APD iConnect to address this need. Supplemental funding for significant additional needs may be one-time, temporary, or long-term in nature. However, the presence of a significant additional need or significant change in condition or circumstance alone does not warrant an increase in the amount of funds allocated to a client's iBudget as determined by the algorithm. Significant additional needs can only be approved after the determination of a client's initial allocation amount and after the WSC has documented the availability of non-waiver resources on the verification of available services form. Documentation of attempts within the last 30 days prior to submitting the significant additional needs request to locate natural or community supports, third-party payers, or other sources of support to meet the client's health and safety needs must also be documented and verified by the WSC on the verification of available services form submitted. Requests for significant additional needs require the client to have a significant additional need as defined in the iBudget rule, and also a significant additional need cannot be created by failing to maintain sufficient funds to cover services previously authorized in accordance with the iBudget rule. The WSC will submit a significant additional needs request indicating how the current budget allocation and requested significant additional needs funds would be used. The request should also include an explanation of why additional funding is needed and any additional documentation appropriate to support the request. The significant additional needs request shall be submitted with an updated support plan, which must include an explanation of why additional funding is needed and indicate how the current budget allocation and requested significant additional needs funds would be used. The request must include documentation appropriate to support the request. If there are any concerns about the accuracy of the questionnaire for situational information QSI results, the WSC shall submit this as well. The agency will not consider incomplete significant additional needs request due to lacking material information to determine whether significant additional needs criteria are met. A significant additional needs request is incomplete if it does not provide detail of the client's approved services, including the number and type of units and dollar amount of each service. The client-to-staff ratio, if applicable, must also be included. It does not clearly indicate whether the current approved services are requested to continue on an annualized basis. The significant additional needs request does not clearly identify any new or increased services being requested in the current fiscal year and on an annualized basis, if applicable to the service type. The completed verification of available services form is missing. The significant additional needs request is missing documentation to support information provided in the verification of available services form, or identify the location of the current valid documentation in the designated data management system. The WSC did not place the request in the proper status for submission in the designated data management system, or the WSC did not identify certification that the request meets the criteria for significant additional needs. The agency shall close incomplete significant additional needs requests upon receipt. After the iBudget amount is established, if a client remains in the same living setting and experiences a significant change in condition or circumstances where the proposed needs cannot be met within the current iBudget amount, the WSC shall request services through the significant additional needs process without the calculation of a new algorithm or the completion of an AIM worksheet. When requesting funds for services on the cost plan, or for significant additional needs, providing complete information in APD iConnect is critical. WSCs will submit significant additional needs requests that reflect the specific waiver services and supports that will assist the client to meet identified needs with all required supporting documentation. WSCs should use the WSC Job Aid for cost plans and significant additional needs documentation, which is incorporated by reference into the iBudget rule. This form identifies the documentation required for each service requested in the cost plan. The documentation identified by this form is part of each request. The agency must close or deny a significant additional needs request without this documentation. The job aid is separated into 3 sections. Sections A and B are relevant to significant additional needs submissions. Section C contains service-specific documentation requirements for all services requested on a cost plan. Prior to submitting a significant additional needs request, the WSC must try to meet the needs within the current cost plan, move unallocated funds to meet needs, move funds from unused services to meet needs, complete the verification of available services form, and provide it with the significant additional needs request. It must have been completed within the last 30 days. Ensure that the support plan and applicable amendments are current in the APD iConnect system. Ensure that the significant additional needs request is completed accurately in the APD iConnect system. Verify that the QSI is reflective of the client's current functional, behavioral, and physical status and completed within the last 3 years. If the QSI does not reflect current information, the WSC must notify APD immediately of the change. The WSC can indicate the date that APD was notified of the need for the new assessment in the request. Section B of the job aid identifies the documentation needed for significant additional needs request based upon the reason for the significant additional needs request. The WSC can look under the types of significant additional needs requests to understand what documentation is needed to support the request. For example, if the client is needing a significant additional needs funding due to aging out of Medicaid state plan services, the WSC should include Medicaid prior service authorization for all applicable services such as personal care assistance and behavioral services and documentation that other caregivers are not available. Section C of the job aid identifies the documentation for each service requested. These documentation requirements appear in the iBudget waiver handbook and must be provided in the APD iConnect system. When the WSC submits a significant additional needs or is having services authorized on a cost plan, these are the documents that must be provided to demonstrate that the service meets waiver coverage and limitations as well as medical necessity criteria. For all services requiring service logs or progress notes, a minimum of the 3 most recent months of documentation is required unless the service has not been provided for at least 3 months. For services requiring a quarterly summary, include the most recent quarter. If the provider chooses to do a monthly summary instead of quarterly, provide a minimum of the 3 most current monthly summaries. Prescriptions, treatment plans, assessments, and plans of care for therapies and nursing must be less than 12 months old and based on current information regarding the client. The Behavior Analysis Services Eligibility, or BASE form, must be less than 12 months old and reflect current behavioral needs. If behavior assistant services are requested, the form must be less than 6 months old. The form documents compliance with requirements identified in the iBudget handbook for services that require review by the regional behavioral analyst. For Consumer Directed Care Plus or CDC Plus consumers, if the client is hiring someone who is not a waiver provider, service logs, quarterly summaries, and daily progress notes are not needed. Meeting documentation requirements is critical. However, sometimes an issue arises where the WSC needs immediate and emergency services to protect the health, safety, and welfare of a client. For emergency requests involving situations that cannot be addressed by revising the client's support and cost plan on a temporary basis, the WSC must notify the APD regional office of the emergency situation. The WSC must provide to the APD regional office the updated support plan and cost plan and any supporting documentation within 3 consecutive calendar days of becoming aware of the emergency. Funding to address emergency situations will be reviewed and approved by APD if the situation cannot be accommodated within the current allocation. This training was intended to help WSCs gain a greater understanding of changes in the iBudget rule that impact the service approval process for iBudget waiver clients. WSCs hold important responsibilities related to ongoing case management and ensuring clients have access to services needed to maintain health, safety, and welfare. For questions and further assistance, please contact the APD Regional Office.